Hello and welcome to Hernia Patient Support Group and to our live chat. Tonight, we're honoured to be joined by Jan Paul again, who's going to be talking to us about the recovery of the abdominal wall after hernia surgery. So welcome, Jan Paul, and thank you for giving up your
Jackie,
time again. So
nice to
I'm
be here.
Jackie, and I am one of the admins of the group. If you do have any questions, you can use the chat button at the bottom, and we can put them to Jan Paul afterwards. The chat is being recorded and will be available on YouTube shortly. So, Jan Paul, the abdominal wall. I think when you have surgery, it's always a worry that you're going to damage it by being active and doing something afterwards. And I think that's one of the biggest worries, and it's something that affects everybody after any surgery.
Yeah.
Can you just, what's the reality of that?
Um, Jackie, I made a little presentation, and in the presentation, you will see somewhere in the slides that there's far more possible than many people think. I'm not suggested that you can hop around and jump around, do everything you want. Of course, you have to be careful. And if you have questions or are insecure, you have to discuss this with your surgeon because
Yes,
he knows how he made the surgery and the
yeah,
operation.
absolutely.
But bottom line, if you take it gently, if you listen to your body, there's much more possible than you think. And that's one of the messages I will show you in the presentation.
Okay. Do you want to start your presentation and then we can have a look?
Do you want me to start?
Yes, please.
I will. I will. Thank you very much, Jackie. I'll share the presentation now and let me see. It's this one. Share. When
That's
I'm
it.
not mistaken, you can see my screen
Yes,
now
yes,
shared. That's correct, eh?
yes.
You see us together,
I
nice
can
and
see it's
cozy.
nice the picture.
Okay, good. Okay, shall we do that, Jackie? Shall I start?
Yes, please. Yes, and then
Okay.
I think if we do your presentation and then we can always have a chat about it.
Perfect. If I'm taking too long, just cut me off and but I think it will be in time.
Not at all.
Okay. So, ladies and gentlemen, viewers, very nice to be here again. I did a previous webinar on diastase recti, which I heard from Jackie was very well received, and I hope I can do the same thing tonight when we talk about recovery of the abdominal wall after surgery. Some little parts of the presentation will look a bit like the previous presentation because we're talking about the same muscles and the same abdominal wall, but I don't think that will press the fun we have in this presentation. So let's get started. Um, I'm going to talk with you about the secrets of your abdominal wall and recovery after surgery. Now, recovery after surgery sounds a bit dull. I would say, how do you get your life back after you've had surgery? How can you get your body working again the way you want to? And maybe you've had some very severe surgery, and of course, getting it all back is maybe a bit difficult, but you can achieve maybe more than what's often thought. So let's have a look at that. So what I'm going to do is I'm going to give a very short introduction about who I am, where I come from. I'm going to talk then about the abdominal wall anatomy, just a kind of the anatomy, not the real dirty pictures, but some picture of how it's functioning. And then I'm going to talk about the post-operative behavior of your abdominal wall. How is your abdominal wall responding to surgery? And what are the effects of that influence of the surgery? And then finally, I will talk about what you can do to improve your abdominal wall function. And like I said to Jackie before, there's much more possible than we often think. So let's get started. First of all, the small introduction. My regular work is working for the Spine and Joint Center, which is a Dutch rehabilitation center, and we treat people with chronic pain. And over the years, already working with these patients for about 30 years. And we are working very much with the abdominal wall because we know that in back pain and pelvic pain, there's a close interaction with how your abdominal muscles behave when you have back pain. So from that, we learned that there's much more than just the back pain. You have to do with breathing, with pelvic floor. And we got to know some surgeons who said we have problems with people after surgery and we can't help them anymore. So what can you do? So we start treating them in our training protocol with our exercises, and to our surprise, they improved very much. And that was the beginning of some of the things I'm going to tell you today. So we treat chronic patients. We are working with functional recovery. We're not just learning them to live their life with their pain. We're really trying to improve their physical function. And it has a lot to do with giving them back their self control over their life and their body, or first their body and then their life. We do that annually for about 650 patients, and we do some research and science, of which is part of what I'm telling you today. So, first, to get a picture on what are we talking about if we're talking about our abdominal wall. And maybe you are acquainted with these kind of pictures, but I thought maybe it's an idea to get this beside it. So you get an idea that the muscles that are there in front, and maybe you can see my mouse here floating around. These are the rectus muscles in front of your body, and that's what you see in the bodybuilders, like these little round things here. But the more important muscles we're talking about are the oblique muscles here, the outer oblique, inner oblique, and most important of them all, it will come back in this presentation far often, is transverse abdominis muscle. It may be a bit a thin muscle, but it's rather strong. And what is very important, it runs from one side all the way to the other side. These two muscles are connected, and together they have a very important function. Now, for the example, I got this bodybuilder, but of course we know our bellies look more a bit like this, or maybe some worse even. It's a bit more fatty. You don't see all these muscles. That's the way it looks. But underneath, you have these muscles almost always. So, if we think of our abdominal wall, we have to realize that our abdomen is like a balloon with liquid, with fluid. And if you would have a very thin wall, it will sink like the balloon, like you see the balloon here. So in our body, we have like this kind of corset of muscles, which when we tense them, can control this balloon of fluid. That's a bit the picture you should have when you think of your abdominal wall. This, by the way, is the reason why many patients after surgery get a bit a belly. That's not only fat, it's also because the abdominal muscles are not working properly. And when they are not working properly, your balloon of water tends with gravity to flow out. So it's not only good life or beer that you get this belly. It has much to do with the function of your abdominal wall. So another thing, if we talk about function of our abdominal wall, you see two little movies here. On the left, you see the movie, what's happening when you are breathing. And I'll get my mouse there in there. If your diaphragm wants to go down because you want to breathe in and you want to enlarge your thoracic space, your diaphragm has to go down. But like I said, your abdomen is fluid and you cannot compress fluid. So if you want to inhale and your diaphragm goes down, the same amount of space, your abdomen has to go out. If your abdomen is not going out, you cannot breathe properly. And if you look very closely, you will also see that your pelvic floor is moving a little bit in the motion. So in proper breathing, your diaphragm and abdominal wall are working together. And next and further on in the presentation, you will see that that might give you some trouble. Now this is breathing. But then sometimes you also have to get some power, like when you're in a supermarket and you want to push your cart around the corner, or when you're walking stairs. Then you have to get some power. And to get power, your diaphragm, you see on the right here, your diaphragm, pelvic floor, and abdominal wall are working in a different coordination. When you make power, your diaphragm contracts. At the same time, your abdominal wall should contract and your pelvic floor should contract. If your pelvic floor cannot contract sufficiently, you might lose some urine. If your abdominal wall cannot contract enough, then it is possible that you can maybe put some intra-abdominal pressure, but not enough to get you really the power you need. So maybe you already start feeling that either on the left side with breathing or on the right side, if something goes wrong, it can have much consequence for your daily function. So let's have a look. So what you have to realize is your abdominal wall has an important role in breathing, in power of your trunk, and actually overall power. Even if you open a jar or a bottle, you get some power in your abdomen. You feel like you're compressing when you really have to make the power. You get that from your abdominal wall. But also incontinence. If there's something going wrong in your abdominal wall, it may have consequences for your continence and also for bowel function. The function of your bowels is dependent on the motion of your abdominal wall. And if for some reason your abdominal wall cannot move properly, that may have consequences for bowel function. Now, so far I've been talking about normal function of your abdominal wall. But then for some reason you have to have surgery. You get an operation. It probably will be an essential, necessary operation for survival. But this has consequences because you end up with some nasty scars. Maybe your serious problem has been healed, but you still have some scars in your abdominal wall. And what are the consequences? Well, you have to realize that your abdomen is this fluid container. And by surgery in your abdominal wall, you get some leakage, which should be repaired again. But then you have to build up control of your abdominal wall again. So, how are we going to do that? First, let's look at the consequences of what happens after abdominal wall surgery. And I got this little model here, this little movie. I hope you can see it. Um, um, for my slides, there are our own pictures in front of it. But can you see the movie? Is that all right for you, Jackie?
Yes,
Can you see
yes,
it?
yes,
Okay,
yes.
good. So
Sorry.
this is a little model of the interaction of your diaphragm above and the abdominal wall. And you can see here the balloon is filled with fluid, with liquid, with water. So you can see if you push your diaphragm down, the abdominal wall comes out. But if for some reason your abdominal wall is impaired, like I did with my fingers, then you see that your diaphragm can go down. So, what can happen if the control of your abdominal wall is not working properly? If it's impaired, you have consequences of breathing. You might feel that you can't breathe freely, or you get some lack of stamina. You can have a lack of power. You can have not all the power you want. You may have bowel problems or incontinence problems, and maybe some even other kinds of problems. But these are the main problems you can encounter. So, what should we do to recover after surgery? And one of the questions was, can you do things that harm your abdominal wall? And like I said, if you start jumping right away or lifting really heavy or doing some weird things, of course you can harm your abdominal wall. But there are many other things you can do which are very low level and which you can use to start improving the function of your abdominal wall. So let's have a look what kind of things that are. If we start at the beginning, the first thing you have to do, which is really important, is to restore abdominal wall dynamics. And what I mean is, like you saw in the previous movie with the little balloon, if you inhale, your abdominal wall should come out. If you exhale, your abdominal wall should go in. You have to realize that's a passive action with only a little bit of stretch of your abdominal wall, with a very low level of tension. So you could do this almost the days after surgery, should this be possible. So inhale is an abdominal stretch, and exhale is a very low level abdominal contraction if you do it. I'll show them later on the exercises. First, get this overview of it. Then, secondly, you want to just build up a little bit more of tension in your abdominal wall. And you can do that by forceful exhalation. I will show you later on how to do that. And then you can gently start with some Dynaband exercises, really low level. And you can do it at home. Maybe you can even do it in the hospital with some Dynabands. Someone has his microphone open.
Sorry, can
What's
we
the question?
please mute? Thank you.
I don't know what's happening, but
Thank
okay,
you.
that's better. Thank you. Thank you. So we do the little bit of contraction of the abdominal with forceful exhalation. I'll show you later on. And then if you can all do all these things, and by that time we are a few weeks further on in recovery from your operation, then we can start to slowly increase intra-abdominal pressure. And what you will see is that increase of abdominal pressure is the last thing you're going to do. In the beginning, it's controlling your abdominal wall with low pressure. That's the trick to do it. And before we go to the real exercises, I will show you, that was one of the questions. This is a little overview of how intra-abdominal wall pressure increases with different activities. I get this information from Professor Jennifer Kruger, which is an Australian professor working with this kind of research. She also made a beautiful movie with some subjects who had a pressure sensor inside, and she can show live how intra-abdominal pressure changes with specific activities. And the interesting thing, the really interesting thing is, if you look at the activities here, first here on the left, you got the lying down, which is a very low pressure. If you stand up, your pressure increases. It's kilopascal, so it's about 3.5 kilopascal. Sitting, almost the same thing. And then here you got the cough, and Valsalva. Valsalva is the power you build up if you lift something heavy or do some really heavy exercises. Then you get this pressure and you get some contraction and you make a high pressure. But what you see in this slide is only with cough and Valsalva you get the really high pressures here. Almost all the other pressures, whatever you do, are relatively low. Even if you do star jumps like this one here, you got a little bit of increase. I wouldn't suggest everyone to do right after surgery, go do star jumps. That's not what I'm saying. But don't be too fearful. The high pressures are in coughing and Valsalva maneuver. There are a lot of other exercises you can do low level, which are relatively safe. Always be careful, beware of intense pains, but be careful, but you can do more than you think. So, with this in our mind, what can we do for exercises? First, we're going to do the breathing exercise. And like I said, if you inhale, your abdominal wall goes out. This is a kind of stretching which may, just after surgery, be a bit awkward because the stretching already might be a bit painful or a bit sore. But if you build it up slowly and allow to do it bit by bit, don't start breathing right away a lot, but build it up a bit by bit, then you can exercise the compliance of your abdominal wall just by gently stretching it. So this is a very good initial exercise. This is low pressure, it's not forceful, but it makes the dynamics of your abdominal wall better. It improves the dynamics of your abdominal wall. Now, there's one thing you have to be careful about. It can be that because your abdominal muscles are not so tensed already, you are almost in an inhalation position. Then your accent should be a bit more to the exhalation and not so much the inhalation, because that range of motion, of course, is limited. So, if you're going to do the exercises, first of all, you have to think of position. I think most people imagine that they start exercising in a position like this. But if you do that, you have to realize that gravity is pulling on the abdominal content and is pulling it downwards towards your diaphragm and towards your pelvic floor. It can be that exercising in this position is heavier than, for example, in the position on the right. If you're a bit more sloped, then gravity pulls more down, and inhaling will be much easier than when you're laying flat. So if you have trouble with the first exercise, maybe you should consider to change your position. Not do it like this, but do it like this. Will be easier. On the other hand, if you're going to exhalation and you want to contract your muscles, then this kind of postures might be well because then the gravity is pulling your abdominal content down and your muscles have to work a bit harder to get the content in. So the position you're exercising in is important. It does count. So then we come to the first exercise. This is what I showed you, the inhalation exercise. And I'm making a mistake here because the lady which is doing the exercise is laying flat. And just before I said you have to be a bit sloped. So please keep in mind you have to be a bit sloped. So what you do nothing actually. You just lay down and be aware of what your breathing is doing. Put your hands just below your umbilicus on your abdominal wall and feel what's happening. Feel the rhythm of your breathing. Maybe you don't feel so much, but most of the time you will feel just a little bit of motion in your abdominal wall. And then what you can do, every time you inhale, just allow your abdominal wall to get it a bit further and increase the excursion bit by bit, very gently. Is it too painful? Just stop the exercise, do it some hours later again, try it again. Every time again, just try to get the motion going. That's what you should do. This is one of the first very easy exercises to get the compliance of the abdominal wall. Don't force it, don't increase your pain. It can be a bit sore, a bit awkward, but not too much pain. Okay? Then this one in between is just a little bit of another kind of exercise because we see many patients who try this exercise and they think, well, I'm there then, I've got my range of motion here. And we ask them, just try to make your belly as round and going out as far as possible. What you actually do then is contract your diaphragm. We don't realize it, but you can voluntarily contract your diaphragm. If you pull out, like the lady is doing here, your abdominal wall, you do it by contracting your diaphragm and you pull out the abdominal content and you can make your belly as round as possible. So, in combination with the previous exercise, this can be very nice to challenge yourself and see how far you can get. Just do it for a second and try how far you can get. That's the second exercise. Then we go further on. Maybe for the people who are listening, we can try it all together because we've been trying the inhalation where your belly goes out, but now we're going to make a little bit of a different exercise. We're going to do the exhalation. And like this little girl in the picture is showing, purse your lips and blow out. And you can exhale. But very often, if you exhale, the first part of exhalation is elasticity of the abdominal wall, but then you can go a bit further. So exhale, but if you're there, you can go a bit further. And you will feel if you put your hands in your side, just medial from your iliacs, your bony points of the pelvis, you will feel that your abdominal wall is starting to contract a bit. That's the exercise you want to have. This is still low level, but just a little bit of contraction of transverse abdominis muscle for the exhalation. This is a perfect next level exercise to initially contract your transverse abdominis muscle, very low level. And then we go on. This exercise is a bit more difficult because if you're standing like this, the gravity is pulling on your abdominal content, and pulling your content in requires more tension of your abdominal muscles. So this is a next level exercise, exhalation for contraction of your abdominal wall, especially deep transverse muscle. Nice exercise. And if you look closely, what you see, it's not only abdominal wall moving, but you also see the spine just move a little bit. I'll see if I can start it again. You can see the exercise going out here. And then she's exhaling, and you see she's flattening her spine just a little bit. That's the exercise. That's it. Relax, not too much, not painful, just do the exercise. And you can do a few repetitions. In the beginning, you do maybe 2 or 3 repetitions. And when you go on, you can start doing 3 series of 10 repetitions. And so build up what you're doing. Now, till now, these were the initial exercises you can do rather quickly after the intervention. But then, after some weeks, I'm not the surgeon, so I have no control on that. But I should say maybe 3 or 4 weeks, you can slowly start to get some more power in the system, and therefore you need some other exercises. I will show you. First of all, the big problem in the abdominal wall is you build up abdominal, intra-abdominal uh, uh, pressure too much too quickly. For example, in the graph you showed with the coughing, if you cough, you really build up intra-abdominal pressure, which gives a lot of tension up on the abdominal wall. So that's the thing you have to avoid in the beginning. And how can you do that? There's a specific trick to do so. What you have to realize is how do you build intra-abdominal pressure? By contracting your abdominal wall in a system, in an abdominal wall which has a specific volume, the filling of the volume with liquid or your intestines and things like that. But you can change the volume. If you exhale, your diaphragm goes up. And when your diaphragm goes up, you enlarge your intra-abdominal volume. The content remains the same, but by raising your diaphragm, exhalation, you increase the volume. And when the volume is increased, even if you contract your abdominal wall, the intra-abdominal pressure will not raise too much. So this is a perfect way to get next level exercise, but relatively safe. Okay? Well, that's what I showed you. If we apply this exhalation, then you can start doing really some more muscle exercises. And these are the same exercises I showed you for the diastasis recti, but it's the same muscle system. So that's what we're going to do. Only with diastasis recti, you can build up much quicker. And here we have to do it a bit more safe. So we're going to start doing the exercises very low level. Like I said, this lady, I'm going to first show you okay. Look at here. This is already far too heavy. You don't lift your shoulders. You just lift your head a bit because if you don't lift your head, I don't know if you say it in English, you can start smuggling or cheating. Maybe it's the right word. You can start cheating by pushing your head against the floor, and then you're using your neck muscles and not your abdominal muscles. So by lifting your head, not as much as here, but just a centimeter or an inch, by lifting your head, you cannot use your head. And then if you make this motion, you will feel your rectus muscles contract very gently. Start gently again. So this is a nice exercise to first train your rectus abdominis muscle. It's not exercised very often, but we consider it very important because it's the front, how do you say it, the front security system of your abdominal wall. So we think you really should also train this. So, but then the more important one, the transverse and oblique muscles. We sometimes think that with this exercise we're only training the transverse muscle, the deep abdominal muscle, but that's not true. You cannot isolate them, so you're also always training them all together a bit. It's almost the same posture as we had previously, but now the Dynaband is coming from the side, a bit above and a bit aside. So when I'm sitting like this, it's coming from that side or a bit more that side. Not from here, from above, from the sideways. And from sideways, what you're going to do, I'm going to get this text there and then we can show it. Okay. What you're going to do is your arms and your shoulders are one triangle, and your hips and your knees are another triangle. And what you're going to do is you're going to move this triangle from your hands from one shoulder to the other shoulder. The motion is only this distance. And it has to do with feeling the contraction of your abdominal wall, go back, hold the contraction, and let go again. What we have to realize is that these exercises are about control, about coordination. They are not yet about power. Power comes later. Your muscles have to get used to getting back into the control. So they are control exercises, coordinative exercises. There's one very important thing I have to tell you, and you really have to take care of that. If you move your hands, look at your hands and move your head in the direction of your hands. And it maybe sounds silly, but it makes a huge difference. You can try it. If you do the exercise and you don't look at your hands, you're only moving your shoulders and you're not getting the force here. It's moving there and not here. And you will feel the difference if you move your head. You start turning your spine and then the motion comes here. You will be aware of that difference. It's really different. So use your head, look at your hands, and move your head in the motion. That makes a difference. This exercise is the most important exercise to recover from the abdominal wall surgery. But you cannot start that right away. You have to do the previous exercises to get the compliance of the abdominal wall, and then you can do whatever you want with this exercise. But first, do the other ones. But this is the most important one. Okay. Now, what we did before here was all to get ready for doing the real, more powerful thing. And actually, the exercises we do are almost the same, but the level is different. So, what we want to do here is get your abdominal wall contract like this. The previous exercise, I'm going to back for a moment. The previous exercise here was just contracting the wall without increase of intra-abdominal pressure. This exercise is about increase of abdominal pressure. Start this slowly, low level, and control. And what are we going to do? It's the same exercise. I got this little bear here. It's the same exercise. But as you can see, the dynaband comes from above and you're going from one shoulder to the other shoulder. This little bear is already making a big motion, but also here the motion is relatively small. Sometimes in the gym, you see these guys going from here to there. They have no clue what they're doing. Maybe they get some more strength, but it's not the proper exercise. This exercise should be neat and gentle with control. As long as you have control, nothing can happen. And then you are safe. So to get your intra-abdominal pressure, you start relaxed on this side where the bear is now. And then you contract your abdominal wall, do the motion, keep the contraction while going back, and then release again. And if you have control, then you can slowly build up the power or the resistance to which you're doing the exercise. So maybe you start with 3 repetitions of 3 times 5 repetitions, but in the end you will maybe doing 3 or 4 times 15 repetitions with a stronger dynaband. And if you want to go to the gym, you got this machines there with a rope and some weights. You can start doing it there too. It's a nice exercise, but start gently, coordination. That's the trick of doing so. So, in conclusion, post-op recovery. There are going to be some questions too, but first let's get to a conclusion. If you do these exercises, it will help you to prevent some kind of complications like not breathing properly, getting infection with some cough or things like that. The breathing exercises will help in this. Then secondly, it will help you to restore the abdominal wall function, especially first of all, the dynamics, the compliance of the abdominal wall. Second, strength of the abdominal wall. And thirdly, increase abdominal pressure control. That's the last part of it. And you will see if you do this, it will help you to improve daily function. Your walking distance will improve. Your breathing will improve. Walking stairs will get better. Exerting force will get better. Your stamina will get better of it. It will improve on many, many areas. And finally, it will also optimize the healing circumstances. Even already the dynamic inhaling, exhaling, the stretching of the abdominal wall will stimulate fibers to heal and will assist and support your healing process. And it will maybe also help with the compliance of the abdominal wall, for example, when a mesh is placed, although that needs some further investigation and study. So this is how it can help. Then, already Jackie sent me some questions. People had questions about training and what to do. And there are some interesting things I read here in the question. This was the first question of 4 sheets of questions. Someone who has pain some hours after doing exercises, and the pain she's feeling is a bruised feeling when standing for too long. And um, I think this has nothing to do with any complication or severity in the abdominal wall. What you read here is someone who is keeping his abdominal wall too stiff, too much in one position. And if you do that, you get some lack of, how do you say that, the bleeding of muscles. You need the blood flow in the muscles. And if you have a constant contraction because you have constantly this tension in your abdominal wall, because if you relax it, it feels a bit painful, so you don't want to do that, you keep it tight, then you get this kind of complaint. You get this sore bruised feeling because it's constantly tight. So the suggestion I have here, try to get the compliance of your abdominal wall back. Try to get the dynamics. And I'm pretty sure it will make a difference if you do that. So that's the answer to the first question. There are more questions here, but I will answer them all together. This is about the healing process, and I've been talking a lot about that. I think the dynamics and the gradual build-up of using your abdominal will help your recovery of your abdominal wall. And that's the same thing, the same question to improve muscle tone. I think I've shown you the exercises you can use to improve muscle tone. Start slowly, do coordination, and you can build up by pretty high levels to do the exercises. And then the exercises in the gym. Of course, be a bit careful with doing heavy lifting. What I would suggest, like I said before, you can in the gym, you can do the most extreme things, but do nothing of which you have no control. Try to build up slowly and always make sure you are in control. One important trick is if you do an exercise, you should be able to stop the motion of the exercise any moment of the exercise. If you cannot stop the motion, because if you're pulling and you stop, you go back, or you have to go to one side because you have to keep it there, otherwise you go back, you're not in control. You do an exercise, and whether it's a pull or whatever you do, if you do the exercise, you should be able to stop here and then continue, because then you are in control. And mostly that's safe at lower levels. Always be careful at the higher levels. Take that, what some further time in after your recovery, I would say. Okay, this is an important one. This is about support garments. I think we're talking about binders or anything you put around your waist. And I heard from surgeons that actually, I heard surgeons say, but maybe not all surgeons agree on that. I'm not sure about that. That most of the surgeons tell me the binders are not because of the sutures. They are because they prevent some of the pain some patients have. And I can imagine that. But what you have to realize is the binders keep your abdominal wall in the inhalation position. And actually, you should as soon as possible and discuss this with your surgeon. When can I start my breathing exercises after surgery? I should ask them, when can I start? I would like to start as soon as possible because the sooner you have this motion in your abdominal wall, the better it is. So the binders may prevent some pain or give you some security, but they also prevent the proper breathing. So if you're too painful, use them, but maybe sometimes over the day, take them off and do your exercises. Then you will have the best effect of them. So it's not a bad thing, but realize the effect of it. And then finally, this is about someone who wants to go back to work with heavy work after 8 weeks. I would say try the exercises. Can you breathe? Can you inhale? Can you exhale? Do you dare to contract your abdominal wall? Is that not giving you some kind of weird pain or weird feeling or faint feeling in what you're doing? If you can control that, do the heavier exercises. See if you can do them. And if you have control, then start thinking of going back to work. Don't make this too quick because then you can maybe hurt yourself. And it's off. I've seen some patients now who said to me, I had my surgery on Friday and on Monday I was back to work. But now they have some weird complaints in abdominal wall because they are too tight, making too much tension, are not moving freely. So take your time. Better recover properly and well than too quick, be a tough guy and have problems later on. That's not a good suggestion. So I wouldn't do that. Take care. So, Jackie, this is the end of my presentation. I
That
hope
was
it was.
It was brilliant. Thank you so much for that. I really learned a lot. I was doing the deep breathing exercises with you then, and you
Did it
could
work
really
out?
feel your muscles working. I do have a few questions that people have sent me tonight, but if anybody wants to ask any questions, please use the chat button at the bottom of the screen. And
I'll, I will stop the sharing, okay?
yeah, that's fine.
There
Okay.
we are again. Okay.
Okay, so I had one question about from a lady who is fine when she gets up for about an hour or so, but then she gets a feeling on the right end of the incision. She's had a long abdominal wall open reef stopper,
Yeah.
and it feels like a leg cricket ball at the bottom of her abdomen. Are there any exercises that she could do?
Like a hard ball somewhere.
It feels her abdomen feels like it's dragging. It feels really heavy at the bottom.
Okay. Yeah, yeah, yeah. Okay, okay. Um, and how many days after surgery
She's
she is?
9 weeks.
9 weeks. Nine. Okay. So after 9 weeks, I imagine that the healing process is already relatively far. So
Yeah.
I would imagine there are not really some what you might say dangerous things you might think of. Then I think the surgeon would already have given you a clue on what's happening. So I think there's something else happening. Like I said, your abdominal wall should be considered as a bag of fluid. And what's happening if you're standing up, this fluid is pulling down. And you should imagine that you have something about maybe 10 kilos of liquid in your abdominal wall. So when you're standing up, it's going to pull on the abdominal wall. So what I would suggest to do, Jackie, tell me, she had it after 1 hour or something like that?
After about an hour or so of being stood up.
Yeah, yeah. Okay. What I would suggest, what she do, she has to get her abdomen back to get used to dealing with this weight. And I would suggest two things. On the one side, I would suggest to her take very regular resting moments lying down to get the pressure of the abdominal wall from the wound she's complaining about. So that will prevent too much irritation. But secondly, she has to start working on training the abdominal muscles because when she gets the abdominal muscles working again, like the little movie of the corset I showed you, it will help to pull in and get some of the tension from the wounds.
Right.
So for the short term, she has to get a bit more relaxation and some pressure of the abdominal wall, make the wall stronger so she can have some abdominal sorry, muscular support, which will get some of the pressure of the wounds. That would be the suggestion I would make for her.
Um, we'll have another man who's asked about singing because that's obviously going to use a lot
Yeah,
of.
perfect. Perfect. Singing is wonderful because if singers they talk about their I don't know how you call it in English, but it's a kind of abdominal support. You
Yeah.
use your abdominal wall. What's happening if you're singing? You breathe in, then you contract your abdominal muscles. That gives you a specific tension on your diaphragm, and that's help you control your voice. So I think if you can start singing in the real proper way, it's a perfect exercise. Yes, absolutely.
Okay, Jeff is asking, after a full recovery, is it safe to eventually resume sit-ups and crunches?
Yeah. Good question. I'm not fond of crunches, as you know from the previous video. What's happening in uh, um, I can imagine that people want to do heavier exercises for their erectus abdominis, the nice muscles where you get these little kind of tiny things you see in the bodybuilders. But the problem is, if you do a curl up or a crunch, you're moving your pelvic floor and your diaphragm towards each other. So, opposite to what I showed you, to decrease the intra-abdominal pressure, like exhaling, where you increase the abdominal pressure, or you increase the abdominal volume and decrease the abdominal pressure. If you do the curl up, you bring them together and you passively increase the intra-abdominal pressure, which may lead to things like diastasis or give you a lot of pressure on your abdominal wall. So, if you want to do some heavier training for rectus muscles, you, for example, could do a kind of lat pull down, but then don't do the crunch, but only do the arms, which is a heavier exercise. I didn't show you that because it's much heavier. It's not for recovery. But if you're in the gym and you want to do it, there are other exercises you can do, but don't do the crunch. It's not a nice exercise for you. It's not going to be good for you.
There's been a few discussions recently about leg raises.
That's when you lay on your back
You
supine
can either
and
do
you.
it lying on your back or you're hanging from something and you're raising whilst
Yeah,
you're
yeah, yeah.
hanging. So there's a lot
Okay.
of pressure going in your abdomen that way.
Yeah, absolutely. It's a heavy it's a bit, you could compare it, for example, to the planking exercises.
Yeah.
That's also a famous exercise. Everyone is doing it. It's a very weird exercise because maybe I'm not should say it, but besides having sex, there are no exercises where you do this kind of planking. You see, so
Yeah.
why are we doing this? And it's a very heavy exercise because you're in one position, keeping everything together, and your body is not made to hold one position for a longer period of time. So planking, I would not suggest. And also the exercise with the leg raises. It's a lot of force on your abdominal wall. And I think there are more gentle exercises you can do. Of course, if you are into sports and you go to the gym, you could do some exercise like that, but they're not the best exercises you can find. Okay? Is that an
Yeah.
answer?
Yeah, that's brilliant. Terry's
Okay.
asked a really good question here about what are your views on the role of nutrition in the recovery process? He's been reading about the benefits of a carnivore diet with high fat and protein with minimum carbs in terms of speed and ease of post-surgery recovery.
Oh dear. You want an honest answer? I have no clue.
No.
No, the reason is I'm not in. Of course, I want to eat properly, but I'm not into all the diet kind of things. The only thing I would suggest is, for example, if you are eating things that produce a lot of gas, it blows up your abdomen and that makes exercise a bit more difficult for you. So, in that perspective, I can imagine that you do something with food, and maybe you can have some nutritions which help you, but I'm not an expert on that, so I couldn't give a proper answer to that.
Terry, maybe
Yeah,
in the
that's one of the
future
benefits.
we can try and find a nutritionist to talk to us, and that might be
Would be a good
useful.
idea. Yes,
Yeah.
Um,
definitely.
I mean,
what
that's one of the benefits of low carb is that it eliminates gas.
Right. So that could be a very good idea. Yeah, definitely.
yeah.
Yes,
Like,
What
indeed.
thank you.
about training before surgery? Does that help with recovery after?
But yes, there are a lot of programs now who do training before surgery. And of course, we have to realize people who get surgery not always are in a very good shape. So, to get some more shape or know what you have to do after surgery by exercising before is a good idea. But there's one but. The problem thing is that we cannot predict how your abdominal wall will respond to surgery. So one of the discussions I'm having with surgeons, they are very fond of doing pre-operative training, which is not a bad thing. But I'm constantly saying, I think we have to be aware to take a look at the patient after surgery to see how their abdominal wall is doing and give them the proper exercises to build up. Because you cannot know how your abdominal wall will respond after surgery. So that's an important thing to take into account.
Okay. Um, we had a question about cycling and does age make a difference to recovery after surgery?
Cycling.
Cycling, is cycling a good exercise after surgery?
This is interesting because it's a bit different perspective. Okay, so if we've gone through the exercises I've been showing you,
Mhm.
then you come to the point where you want to do some other exercise like walking or running or cycling. Um, the interesting thing is that I'm coming back to the cycling, but I'm starting with walking first. If you walk, every step you take gives you a little pulse of intra-abdominal pressure. So if you want to do dynamic exercises, I would first suggest do walking or maybe then a little bit of jogging. Oh, but just even walking is very good. And there is right away the difference with cycling. I'm not saying that cycling is a bad thing. If you want to cycle, please do what you want. It's perfect. But there's a difference between cycling and walking. If you walk, you have the spikes on pressure. If you're cycling, you're sitting on the saddle and you're making pressure with your feet on the pedals. So you get this kind of pressure in your abdomen, which is less dynamic than when you're walking. So is cycling bad? No, not at all. Is it the best exercise? I'm not sure.
What
Is that an
about
answer?
age? Yeah,
Sorry.
sorry. What about age? Does that make a difference to how people recover? The age
What?
when you have the age
Oh,
you are when you have the surgery, does that
yeah, yeah,
have
yeah.
any effect on?
Well, there's yes, regrettably, age does matter, but it's rather crude. If you are above about 35, you will notice that recovery processes take a bit longer. Um, so there's this very crude line that before 30, after 30. But if you take in account, for example, smoking is much, much worse than age. If you have someone of 25 who's smoking, he may be worse off than someone of 60 who's not smoking. So I would not mind too much about recovery and age. Yes, it takes a bit longer, but don't worry about that. I wouldn't worry about that. I would worry about smoking, maybe alcohol, some nutritions maybe, but age, that's what you have to deal with.
Yeah, you can't do anything about it, can
No,
you?
you can't get younger.
No. No, not at all. So I think one of the main messages that we tell people is to listen to your body, and that's something what you've talked about tonight, isn't it? And when something hurts, it's time to stop.
Yeah, but I would like to make an additional remark to that because I think some people might now think, yeah, everything I do is hurting, so I can't do anything because it's all hurting. But there's what you have to realize: if you have the surgery, you have some wounds internally, and we have to realize that abdominal surgery is severe surgery. It's not a little thing you do; it's severe.
Mhm.
So there's a lot going on, and there's a lot happening in your abdominal wall if you recover from surgery. So you have to realize that sometimes it can be a bit painful if you do something. And if you start exercising, it can be a bit sore. And maybe even sometimes you do an exercise and you feel this fling and you think, oh, maybe some stitches broke. What you have to realize, if this pain disappears after some hours, it probably is not a problem. If you keep a pain for days after you've done the exercise, then maybe you should consult a doctor because then maybe something went wrong. But in the process of healing, sometimes you can feel some more pain, which is not so severe. That's not a problem. That can be part of the healing process.
Yeah, I agree with that. Especially if you're going to be doing the breathing in the first few days, it probably is going to be uncomfortable whilst you're doing it, and it's
Yeah.
something that you just go through.
I was talking about Hakan,
Yes,
about what we are talking about
yes.
you put this mesh in an abdominal wall, at least the surgeon is doing it.
Mhm.
A mesh in the abdominal wall. And then you get the binders the first days, and this mesh has to grow into your abdominal wall. But if you start breathing, your wall is going to stretch out, and your mesh has to comply with this motion of your abdominal wall. And maybe there's something already, some fibers connected to the mesh, which are a bit too tight. So maybe they have to get some more room. And that can be the feeling you have for a moment. So if there's a painful spot for maybe 1 or 2 hours, it's not a problem. If it's away afterwards, don't be afraid of that. You will know the difference if there's really something wrong in
Yeah,
there.
yeah, you will do. Well,
Okay?
unless anybody's got any other questions, we've been talking for about an hour now, Jan Paul. It's gone really quick. Yes, time's gone really quick. So unless we've got any more questions anywhere, I think that's about it. And I'd love to say thank you so much for that because that was so interesting. It's been really helpful. I've learned a lot myself, so I'm sure it's going to help many people as they recover from their operations.
I hope so. I hope so, Jackie. It was very nice. It was a pleasure to do it. I hope everyone can do something with it. And like I said, if there are any questions, just send a message and we'll try to answer that.
Thank
Okay?
you, Jan Paul. Yeah, and
You're
I look
welcome.
forward to seeing you in Paris.
Well, looking forward to see you there.
Take
See
care.
you.
Thank you,
Thank you very much.
everybody.
Have a
Take
nice
care.
evening.
Thank you.
Bye bye.
Bye.